Welcome to Rudy's lecture. Let we see the basics of anatomy, and we are going to see this lecture video of what are the basic terms, anatomical terms, and basics of anatomy. So we all know that anatomy is the most competitive subject in the first year. The whole the medical student is going to face. So for that, let me see how easy is the anatomy and how we can study anatomy very easily in the perspective manner. Okay, or as all we know that the anatomy is a science that is dealing with the human body. That is a study of science that dealing with the human body. And we know that anatomy is mostly it is derived from Latin and Greek words. So see anatomy as a language and discuss among yourself between your friends whenever you're in a anatomy class or even not in an anatomy class. Discuss yourself in the medical terms, which is denoted as well as like so that that will remain your knowledge and better remaining. For example, do you have a pain in a shoulder? Just don't say that your friend you have a pain in shoulder. Say that exact muscle. If you have a pain in the deltoid, or if you have a pain in the brachialis muscles, or if you have a pain in the biceps muscle and the portion, if you locate and if you discuss among your friends if the anatomical term, that it won't go out from your memory. It will always remain even if a person is going awake from the night, and if asking where is the deltoid muscle, you can easily able to locate the muscle, and so that you can able to remind all the terms of anatomy. So discuss among yourself and anatomical terms. How to study anatomy? It very easy manner. First thing you need to memorize. As I said, when you're entering from a grade 12 or 12th standard to a medical college, it is a new term for you. So everything will be in the new term. So first thing you have to memorize, and you should need to keep on practice. So first thing, do memorize and practice. And second, whenever you're studying, keep a model and slides along with you. It will help to better locate and have to better remind. Then don't miss the cadaveric, that is a practical classes whenever you have. And the next one is the main thing, practice more diagram. It might help you gaining a more mark in exams. So try to draw a diagram whenever it is needed and as much as is possible. So because when you diagram, it will look very very attractive, and even it gains you a more mark. And please use the colors only red, blue, green, and brown. We are using red for artery and blue for veins, green for ligaments and tendon, and brown for muscles. And then the another important one is keep mnemonics and study as much as possible with mnemonics, because this will gain you a more better knowledge and better regain. You can regain easily whenever the question is asked. So if the mnemonic is in your mind, you can easily get the answers. For examples, we have a carpal bone mnemonics that easily everyone will know that she looks too pretty, try to catch her. That scaphoid, lunate, trichotrum, pisiform, trapezium, trapezoid, capitate, and humate. So try to keep some mnemonics that whenever the question asks, you will get the mnemonics on your mind. Then the answer will strike you easily. We'll see now the subdivisions of anatomy. We have a subdivisions of anatomy. First one is a cadaveric, that is dealing with a dead body, a Gray's anatomy. Then we have a living, for example, that is a palpations, that is a living anatomy that we can. Next one is embryology, that is that is also known as a developmental anatomy, that is in the period of gestation. It occurs in the gestation period from the formation of cell to baby. That is also known as a developmental anatomy. Embryology, that is the formation of cell to baby in the gestation period, is also known as a developmental anatomy. Then we have a surface anatomy. It is also known as a gross or a topographic anatomy. Then the histology, that is a microscopic anatomy, the dealing the under of microscope. Then the important one, that is experimental, that It is going as investigations. That is a radiological anatomy that I have written as experimental. That is a radiological anatomy that we are dealing with investigations. For example, X-rays and CT, etc. And another important one is applied anatomy. That is clinical anomalies. So we have a cadaveric, living, embryology, histology, surface or gross or topographic anatomy, experimental, that is radiological investigation anatomy, and then we have an applied anatomy. So I have given the basic, very basic subdivisions of anatomy. So in the first anatomy class, most of you will get teached with anatomical terms. That is the most important thing. Without this anatomy and the physiology also same. As I said, the anatomy that is dealing with the structure and physiology, we are dealing with functional. So without these, we can't become a professional. And the main thing that anatomical terms are very important, that it will come throughout your medical professional. Even it will be help you in the exams, vivas, MCQs, in clinical assessment, because you should know where there is actually present, whether be medially, laterally or anterior. These are the anatomical terms you should know as much as a very basic one. That is to point out specifically. If we see that anatomical terms, we have an anterior, that is also known as a ventral, that we used to mention the front of the body. We used to mention the front of the body. Then we have a posterior, that is also known as a dorsal. We can mention anterior as ventral and dorsal, posterior as dorsal, that is a back of the body. We used to mention the back side of the body. Then we have a superior, that is above or towards the head. I used to mention above towards the head. Then we have an inferior, that is nothing but below or towards the feet. So these are common terms to point out specifically. We have proximal and distal, that is mainly used only for the limbs, to denote the limbs, discussing the 2 points between the limb. For example, elbow and forearm is there. We used to say that forearm is proximal to elbow. What is proximal? Proximal is closer to arm or leg. That is closer to arm or leg. And we have a distal is further away to the arm or leg. For example, for proximal we have can take elbow and forearm. That forearm is proximal to elbow, that is closer to the elbow. And for distal we can take elbow and wrist. That wrist is distal to elbow. The wrist is distal to elbow. We have a medial and lateral. That is nothing but in our body we used to have imaginary midline. Like there is anything that is towards the midline or closer to the midline is denoted as a medial, that is closer to midline, and later is a further away from the midline, that is further away to the midline. We have seen anterior, also known as a ventral, that is front of the body, posterior, that is also known as a dorsal, that is the back of the body, and superior, that is above or towards the head, or inferior, that is below or towards the feet. And we have a proximal and distal, that is used only for the limbs to donate, and that is proximal is closer to arm or leg, and distal is further away from the arm or leg. And we have a medial and lateral. Medial is that is closer to the midline, lateral is further away to the midline. Next we are going to see the planes. We have a sagittal planes, frontal plane, transverse plane, oblique line. We'll see what is the plane. The plane is nothing but that divides the body, and we have a sagittal plane. This sagittal plane is nothing but divides the body into a right and left. It is going to divide the body into right and left. This sagittal plane is further divided into a mid sagittal plane and parasagittal plane. This mid sagittal plane is dividing or cutting on the midline, that is dividing or cutting on the midline. This parasagittal plane is nothing but further away from the midline. Okay, that sagittal plane is nothing but divide the body into right and left. The sagittal plane have a mid sagittal plane and parasagittal plane. Mid sagittal plane is dividing or cutting from the midline. A parasagittal plane is further away from the midline. Then we have a frontal plane that divides the body into anterior and posterior. That divide the body into anterior and posterior. Then we have a transverse plane that divides the body into superior and inferior. See, we have sagittal plane that divide the body into right and left, and frontal plane that divide the body into anterior and posterior, transverse plane that divide the body into superior and inferior, and then we have another plane that is called oblique plane that can divide the body into any angle. That can divide the body into any angle. We have seen anatomical terms, that is anterior, posterior, superior, inferior, proximal, distal, medial, lateral, and we have seen the planes, that is sagittal plane, frontal plane, transverse plane, and oblique plane. Then we are going to see the actions. We have a flexion, extension, abduction, adduction, supination, and pronation. And then we have a rotations, that is medial rotation, lateral rotation, and in some other joint that going to that we are going to see in a different elevated topic. Now we have the basic actions, that is flexion, extension, adduction, abduction, supination, and pronation. Now see the flexion. This flexion is nothing but it's going to decrease the angle between. It's going to decrease the angle. Like how? Then we are going to see. Consider we have the this is a metacarpophalangeal joint. Then this is the joint. When I'm going to flex this, the angle is getting decreased. So the angle is getting decreased. That's why the flexion is called decrease, to denote the decreasing the angle. The same opposite extension is going to increase our angle, increase the angle at the joints. Then we have a abduction and adduction. Abduction is nothing but it is further, it is moving from the midline, that is we are moving from our body to the further side, that is called abduction. Adduction is towards the midline, that we are getting towards the midline. Abduction is further away to the midline, that is we are abduction is, that is we are moving the any part, like if we take a shoulder joint, when we abduct the shoulder joint, it is going to away from the midline. When we adduct, it coming towards the midline. So adduction is towards the midline. Then we have a supination and pronation. Supination is nothing but the palm is facing outside. Palm facing outside. And the pronation is nothing but the palm is facing inside. See, for example, this is called a supination. When the palm is facing outside, that is called a supination. Pronation is, that is palm facing inside. The palm is facing inside is called a pronation. For pronation, we can keep it simple as when we are going to promise someone, we are going to promise like this. We are going to keep the hand like this. So pronation, promise. We are going to, the palm is facing inside. So we can remind it. Pronation is palm inside and supination is palm outside. So the action we have seen flexion, extension. The flexion is going to increase the angle at the joint, and the extension is, flexion is going to decrease the angle and extension is increasing angle. Abduction, that is further away to the midline. Adduction is towards the midline, and supination is palm facing outside and pronation is palm facing inside. So these are the a very complete basic anatomy lecture. So we have seen how to study anatomy and how to keep remind. So we have to memorize and practice, and we had whenever you're keeping studying anatomy, keep model and slides, and then the practical anatomy, and then I have said to draw a diagrams as much as whenever it is needed in examination, and whenever you're free, try to practice a more diagrams. That diagram will gain you a more marks. And then mnemonics, that is a basic thing for each and every subject, even for pharmacology, general surgery, pediatric, for all the subjects which you're going to study in the future. The mnemonics will play a vital role in keeping this memory. Then We have seen the subdivisions of anatomy, that is cadaveric, that is really dealing with the dead body; living anatomy, that is for example palpations; and then embryology, that is a developmental anatomy, for that is in the happen in the gestation period from the formation of cell to the baby. And then we have a surface anatomy, that is also known as gross or topographic anatomy. And then histology, that is also called a microscopic anatomy. Then a radiological anatomy, that is experimental anatomy. We are going to investigate by the x-rays and CT, for example. Then applied anatomy, that is a clinical anatomy. Then we have seen the anatomical terms, that is anterior, posterior, superior, inferior, proximal, distal, and medial and lateral. And then we have seen the plane, sagittal plane, frontal plane, transverse plane, and oblique plane. Then we have seen the actions, flexion, extension, abduction, adduction, supination, and pronation. Hope you all clear with this basics of anatomy. In future videos,